Bismillahirrahmanirrahim. Assalamu alaikum wa rahmatullahi wa barakatuhu. Hope so you all are enjoying my videos a lot and getting maximum information. Well, today we are going to discuss about the disorder of the kidney. One of the major disorder of the kidney is kidney stone. Well, what is basically the kidney stone? When a stone used to be stuck in the kidney or in the urinary tract system, then this is known as a kidney stone. Basically, when the urine used to become concentrated, having more salt, then it formed basically the crystals or the stone. These salts used to accumulate and form a stone or a crystal, and this is known as a kidney stone. If you're going to look at the stones, then basically stones are of different sizes. Some are quite small and some are quite large, and these large kidney stones are basically very hard to remove from the kidney. Now, what basically salt is the most common which is causing the kidney stones? The most common salts which are forming the kidney stones are the calcium, oxalate, calcium, phosphate, as well as ammonia, phosphate. Basically, when this salt is going to get concentrated in the urine, it used to form a large crystal. And this large crystal used to deposit into the kidney. And this deposition of the large crystals into the kidney is known as the kidney stone. Well, the kidney stone is not only present in the kidney, but it can pass to the ureter, where the stone is going to stuck and is going to give the pan, as well as in the urinary bladder. What are basically the causes of the kidney stone? One of the most important factors is basically the age. As you are going to get older, the risk of the kidney stone used to get increased. The other most common is our diet. If you are going to take enriched amount of the green vegetables, as well as high amount of the salts, vitamins, especially D and the C, as well as recurring of urinary tract infection. The urinary tract infection is basically the infection in the whole urinary tract: kidney, ureter, urinary bladder, and urethra. So, again and again, infection in the urinary tract will lead to the kidney stone. Moreover, if we are going to take the less amount of water, as well as if we are consuming the alcohol in the high amount, this will lead to the kidney stones. Let's see what are basically the symptoms of the kidney. If we are going to discuss about the symptoms, then this includes the severe pain in the kidney, as well as the severe pain in the lower abdomen. As you know that the kidney used to locate in the abdominal cavity at the back side of the abdominal cavity. It will also cause the vomiting and the frequent urination. The frequent means the frequency of the urine is going to increase and you are going to pass the urine again and again. It will also result in the foul smell due to the presence of the blood and the pus. As you know that what is the pus? The pus is basically the dead white blood cell. So, what will be the treatment of the kidney stone? The 90% of the kidney stones used to remove even by excessive drinking of the water. If we are going to drink the excessive amount of the water, then the 90% of the stones used to remove out. But there is also a non-surgical methodology that is known as a lithotripsy. The lithotripsy, in that lithotripsy, we use the non-electrical shock waves. And these waves used to bombard on the stone. And when these waves used to bombard on the stone, then the stone used to break into the smaller pieces. And it can easily be removed out from the kidney as well as from its track. In the lithotripsy, the non-electrical shock waves used to pass through from the urinary tract system. These waves used to break the stone that is present in the kidney that is attacking the pathway. These waves used to bombardment on the stone and then break them into the sand-like. And this stone become the sand-like. That is enough small that it can pass through from the ureter and from ureter to the urinary bladder and from the urinary bladder out through the urethra. This is the easiest way to remove out the stone. The next thing which we are going to study is the kidney failure. It is also called renal failure. Well, what is happening? What is basically this kidney failure? When there is a complete or partial, partial failure of a kidney. To its function means that when the kidney completely or partially fails to perform its function. This is known as the kidney failure or the renal failure. The kidney failure and the renal failure is that kidney fails to perform its proper function completely or partially. The two main reasons which are recognized till now of the kidney failure is the diabetes as well as the hypertension. These are two leading causes which can lead to the renal failure. As well as one of the most important reason is interruption, a sudden interruption of blood supply towards the kidney. When there is when there is a sudden interruption of the blood supply towards the kidney, that will also lead to the kidney failure. And one of the most common reasons is the overdosage. Overdose of medicine or any kind of the drug will also lead to the kidney failure. If we are going to discuss about the main symptoms, then what will be the main symptoms? The main symptoms which can represent us the failure of the kidney, what are they? The main symptoms are high level of urea in the urine and other metabolic waste like creatinine, urea, uric acid. It will also result in the vomiting as well as in the nausea. This will lead to the weight loss. One of the most common symptoms which you might have seen in the kidney failure is the swelling. The swelling of the legs, feet, as well as face. This is due to the presence of the excessive amount of fluid in body. As the fluid is not removing properly through the kidney, so there is an excessive amount of the fluid used to collect in the body, and this will cause will cause the swelling of the legs, feet, and the face. So, one of the symptoms is also that frequent urination, as well as blood in the urine and the pus in the urine can also be observed. There is also the shortness of the breath is observed as a symptom in the kidney patient. So, some common symptoms which we have observed is the urea, high level of the urea, vomiting, nausea, weight loss, swelling, excessive amount of the fluid is collected in the legs, feet and face which results in the swelling, as well as the frequent urination, blood pus in the urine and the shortness of the breath. Now, what happens if once the kidney is going to fail? What happens if the kidney is going to fail? Yes, there is one other treatment named is the dialysis. What is the dialysis? Dialysis is basically the artificial way. There is an artificial way to clean the blood. What do you mean by the artificial way? Might in this artificial way, we are going to use the technology or machine. So, other than the natural way, the artificial way is used to clean the blood. Nowadays, there are basically, up till now, there are two types of the dialysis, named as peritoneal dialysis, as well as the other one is the hemodialysis. The peritoneal dialysis even a patient can do in a home, but it used to do on the daily basis. And the hemodialysis, you have to move towards your doctor, to the hospital where the dialyzer machine is present. The dialyzer is the machine which is used in the hemodialysis. Well, let's discuss what is a peritoneal dialysis. Students, listen to me very carefully. What is a peritoneal dialysis? The peritoneal dialysis actually occurs in the peritoneal cavity. This peritoneal cavity is present in the abdomen. The abdomen has the cavity named as the peritoneal cavity. This is the peritoneal cavity that is present in the abdomen. The peritoneum cavity is basically surrounded by a peritoneum. The peritoneum is basically a semi-permeable membrane which used to let to diffuse out the salt, not the blood. Some kind of the small size particles to pass through this peritoneal membrane. If you're going to observe then, the peritoneal cavity is surrounded by the peritoneum, and this peritoneum also contains the blood vessels. So, this peritoneum cavity that is present in the abdomen is surrounded by the peritoneum, and this peritoneum also contains the blood vessels. The peritoneal cavity is filled with the fluid. And when this peritoneal cavity is filled with the fluid, the salt particles or the waste material used to pass through this peritoneal semi-permeable membrane and will enter into the dialyzing fluid. And then this fluid is taken out as the waste material. Basically, this is the peritoneal cavity present in the abdomen. This peritoneal cavity will be filled with the dialyzer fluid. The peritoneal cavity have a peritoneum that is a semi-permeable membrane and acting like a this basically peritoneal cavity is going to filled with the fluid. The peritoneum layer is a semi-permeable layer and it contains the blood vessels. The salt and the other particles are going to enter in the peritoneal cavity, while the blood is not going to pass through, because peritoneal membrane is going to act as a semi-permeable membrane. Salt and the metabolic waste are going to collect, and then this will be removed as the waste. This fluid will drain out from the peritoneal cavity and will be as a urine. Now again, this cavity is going to fill with the dialyzer fluid. And then this again cleaning procedure. This basically continues